understood and not really appreciated. In fact, really when you look at, I think of all the legislation that's ever been written or codified by Congress at a federal level, the hospice benefit is really one of your most elegant benefits in the sense that it's an earned benefit as you age and become eligible through it, either through Medicare or Medicaid, you have complete access to it. So if you were deemed appropriate in the way the benefit is written, from a language perspective, is you're eligible for the hospice benefit. If your disease were to follow its normal course, it's expected that your life expectancy would be 6 months or less. And that then becomes another point of question for individuals is, that whole 6-month window. Sometimes that's a question for physicians with, how do I predict that? How do I know? I don't have a crystal ball. I can't predict if somebody's going to live 6 months or less. That's a very collaborative process between us and the referring physician to complete an appropriateness evaluation and determine whether or not somebody would be eligible for the benefit based on any number of diseases that we provide care and service under, ranging from cancer to Alzheimer's to dementia to adult failure to thrive to various cardiac diagnoses. I mean, really the range is really fairly long. And 6 months is not an atypical length of stay, but nor is it atypical that we have persons that have been on service for a year or even greater, and even done so well under hospice with that team of professionals that's working with them, where they graduate from hospice. So it's possible to come in and out of hospice as well while you're on the benefit, and so there's no limitation to numbers of times that you can take advantage of the benefit if a person's situation should improve. Our average length of stay here in Dublin and Columbus market for our patients is in that 60-day kind of range. It ebbs and flows a little bit depending upon the month and number of patients admitted and number of patients that have come off of service. But if you think about it, that's a relatively brief period of time, given that the benefit was really written to be 6 months. Folks are only taking advantage of about 2 months of that. So it's more typical that we get referrals late rather than early, unfortunately. And I think what was addressed in the video is that very often we do hear that comment, gosh, I really wish I just had the opportunity for us to have accessed it earlier and taken advantage of the benefit sooner. Mark Twain was unfortunately right on a lot of things, and one of the things that we really write about is that one of the things that we'll all face collectively is taxes and debt. Given that we're coming up on the tax season, we know that that's impending for us. Come April 15th, and our mortality is it's a sealed deal. How we approach death in the United States, I think, is still a conversation that's unfolding for all of us in a very collective sense. I don't know if anybody here listens to National Public Radio, but they had a story Wednesday on Morning Edition, if you were listening to it in the morning, about a community in Wisconsin called La Crosse. And the community La Crosse has embraced a conversation as a community about how we're going to age and how we're going to die. And they have a 96% participation rate in everybody in that community having advanced directives in place. That's an amazing figure if you think about it. And this is a large, relatively speaking, metropolitan area that has a 96% participation rate in advanced directives. How many here have an advanced directive or a living will in place? So that's a fair percentage. That's great. That's an important document to have in place. The other really important document, especially in the state of Ohio, is to address your DNR status, what's called your code status. So do you want to be fully resuscitated? Do you want to be DNRCC, DNRCCA with assist? So make sure that you address that as well. But for those of you that don't have an advance directive or a living will done, that's an important piece of information and data to get done. There's an attorney in the room. She can certainly speak to that or refer you to somebody who could assist with that. But that will help guide your loved ones and your family members with what your wishes are should something tragic befall you, or if your parents are aging and they have a healthcare crisis, it will help guide you at that moment in time as well. What you don't want to be doing is be in a situation where you've got a family conversation occurring in a moment of crisis and you're not able to make those decisions. Far better to have that planned out ahead of time. So I would suggest that that get done. Our role as hospice providers in the healthcare continuum is continuing to evolve, and it's expanding. We see in some communities, in some counties, participation rates as high as 60 or 70% of persons who die with hospice in place. And that can make, I think, a significant difference in terms of what that outcome is like, what the quality of that experience is like for themselves, meaning they're dying, pain-free with their wishes honored. They're dying in a setting of their choice, and they're dying surrounded by, those that they care about and care for. So hopefully that will continue to grow and expand as well. We've been a part of the Dublin community now for some 4 years. Our office in the Metro B building, so we're in Metro Place, the 655 building, and that's really where our administrative offices are. All our work is really done out in the field by nurses and caregivers that see families and patients across the 13 county metropolitan area. We have 120-ish patients on service today. I have some 60 employees that work for us in the Dublin office, providing care across those 13 counties. We're certainly very pleased to be a part of the Dublin community and part of the fabric that is Dublin. One of our team physicians practices here in Dublin. Robin Houston is her name. She's with Family Physicians, and she's been a team physician for us now for some 3 years. And her husband, Tony Restuccio, works in Westerville, was also a team physician for us. So we're here. We're an active part of the community. We certainly appreciate the opportunity to be a part of your meeting today. I will confess disappointment that Faye's prediction on being peppered with questions didn't come true. I can't imagine if we're on.
You haven't asked a question yet.
Please ask away.